Hello, everybody. Today, we are going to talk about something which is for surgeons, might be kind of uncharted territory. How can operational research science help in organizing surgical care? Well, you might think, I'm a surgeon, I'm doing surgery. What should I do with coordination and operational research science? This is not for me. I'm trying to convince you that this is for you for many reasons. One, if you know how the system is running, then you can optimize what you are doing. Second, if you know how the system is running and how to make it better, then you have a better chance to introduce new innovation because then it will not block the system, it will not make a delay in the system, and it will be cost effective. So why don't we go through this journey and talk about how operational research can improve surgical care? Remember that this is just one talk of 12 talks about roadmap to innovation in surgery. We started with the history of innovation, and then we went through research, modeling, how to build the multidisciplinary team, and we talked about tools of innovation, and then we had some talk about scientific debate and leadership. Last talk, we talk about cost effectiveness in surgery. And to make any innovation cost effective, we need to change the organization of surgical care. And that is what we are going to talk about today. Hospital is a very complex system. Many parallel groups working together to deliver the care, the needed care. And these parallel groups are subject to human factor. We can be ill, our children can be ill, we might have some childbearing, we might have other events in our lives. There can be some conflicts because we are human, we have emotions, we have ideas, so this make it complex. The human factor make this system complex. Another thing that makes this system complex is the unpredictability. They can come some emergencies, they can come some catastrophe. For example, there can be some unpredicted uh, events such as an operation time which is getting longer, or an operation where there is a complication, intraoperative complication, which changing all the schedule. This makes the system difficult to run and difficult to coordinate. But this is not the only system which is complex and need huge coordination efforts, because there are other systems where also there are parallel groups working together to to, um, to have an outcome. One of those systems is the airport. It is also a system which can be affected by unpredictable events, such as change in the weather, machines that not working, personal strikes, illness, all these things. But all those parallel groups work together for one definite outcome. We put the passenger on the flight and we make sure that the flight is flying. Another system which is also complex and need huge coordination is the military. And here, operational science research has been implemented actually in the Navy to see how many pieces of the Navy should be there, and in the Air Force to see how the constellation of jet fighters and what is the best number 5, 10, 15, 2, what is the best constellation and when. The same for the panzers and the troops. And this system must work best to ensure that the soldiers' life will be protected. So you can see the denominator in all those complex systems is the coordination. Coordination is science, but there is an art. There is an art for coordination because there's so much innovation to put things in to work together. So let us talk about coordination and how operational research can help us in coordination. Let us start by defining operational research. Well, operational research is a discipline that uses advanced analytical methods to help better decisions. Analysis, for better decisions. Very simple. And here is mathematics here. There are data, and this data will be used for analysis, and the analysis will be used for decision making. So you might say, I'm a surgeon, what is this for me? Yes, operation research is a way to use mathematical models, statistical algorithms to optimize various aspects of surgical care. Think about scheduling the operations, resource allocation. Now we are very specialized, so you cannot put this surgeon instead of this surgeon and say that this will run. We are much specialized. The patient flow, patient they want to come to the hospital, everything is there. The overall efficiency of the system, all this needs a huge amount of coordination. Therefore, there are some key concepts in operational research. One of those key concepts is the statistics and data analysis. Actually, it is the most important concept in operational research. When we apply statistical methods, we can understand and predict outcome based on data. So this is a data-driven understanding, which make it powerful because it is depending on real-world data. The question is how we analyze those data and how we can make some wise conclusions from those data. When we have those data, then we can build a model. Modeling is creating a mathematical representation of real-world system. This will help us to analyze how the system is working and how we can improve the system. If we have the system, then we can test the system. This is done by simulation, because when we can use computational methods to replicate and study the behavior of complex systems, then we can see where are the mischievements, where are the problems, where are the challenges in the system, and how can we tackle them. We don't have this yet in surgery. That's why I say it is uncharted territory. But it is fascinating. It has been used in airport, for example. It has been used in military. It has been used in other disciplines. And then if we can simulate the system, then we can find out how to make the system better, finding the best possible solution given the constraints and objectives. This is optimization. Finding the best solution given the constraints and objectives. The system is optimized, then we can use it and iterate until it becomes much, much better. So how can operational research science be used in organization of surgical care? Now we know that there are the concepts of this operational research, which are the data, statistical analysis, the modeling, the simulation, the optimization. Let us see how can we use it in surgical care. Staffing, as I told you, working force, because we are as surgeons, we have some endoscopic surgeons. You cannot put them to take a task for complex colorectal surgery, for example. The same for colorectal surgeons, they might not be the best to solve a kind of bariatric surgical problem. So you need the staffing. Surgeons are at different levels of their learning curve. You cannot put a junior surgeon to solve a complex operation, for example. So you need to take care of all those factors, and this is complex. When if it is one or two, it is easy. But if you have, for example, a department with 50 people, 50 surgeons, how to put them according to their level and specialization. And then you need to optimize the patient's flow. The patient will not come one day for taking the blood investigation, another day for talking with the surgeon, and third day for the operation. You need to optimize this and optimize the patient also. And then you need to tackle the unexpected events and use this for risk management and decision support. Who is going to do this if someone is ill or something like this? Another implementation of operational research in surgical care is inventory and resource management. Imagine that you have a robot. You have gynecologists who want to use it. You have the urologists want to use it. You have abdominal surgeons want to use it. How can you optimize this? Who is using the robot and when? This is an example. And then the operation room is another very good example about operation research. Operation room is kind of place where there are many groups involved. You have the anesthesiologist, the the anesthesia nurse, you have the assistant nurse, you have the circulating nurse, you have the technician, operation technician, the cleaning people, the coordinator of the operation. All these people should work in parallel to give the surgeon the possibility to do their work. And then workflow automation. Interesting. In my hospital, we have 3 consultant surgeons sitting with a secretary for hours, many, many hours every week to make the week plan for the surgical department. And when I see them, think, oh my God, are we in the information technology era? This problem can be solved by a computer, and the computer can be objective and can be much better to solve the problem and optimize the flow. It is just a question about introducing those concepts to surgeons, because it is, as I said, uncharted territory for the surgeons. It's not what we hear as surgeons. And then if we can optimize the flow, we can test our innovations. We can test our innovations and show that they minimize the cost and they increase the benefit. Then we can go to the policymaker and say, look, I have a new solution which decrease the cost and improve the outcome. There is no policymaker will say no to such a solution. So that's why surgeons should understand these concepts of coordination. Sorry. Remember this slide from our presentation about leadership. We said that the surgeon is in the center, and the surgeon want to make his or her show, while other parallel groups will all work together to enable the surgeon to make this peak performance. And the leader should make sure that all those groups are working in optimal way so that the surgeon can achieve the peak performance. That's why we talked in the leadership uh, presentation, we talked about the roles and responsibilities of leaders in surgery, and there are many. Some of them, they are overseeing the patient's care and ensuring the adherence to the guidelines and safety protocols, encouraging research, mentoring junior surgeons, and all those responsibilities for the leader will help the leader bringing out the best in every member of the team. We try to breed such a leadership positions. We try to encourage and train members of open source research to make such steps. We try to build models of intervention. Like if you remember the second presentation about modeling of surgical intervention, then we tune the model to reduce the cost and increase efficiency, and then reiterate to optimize the model. This is the way we are working on in open source research collaboration when we are taking research or solving problems or challenges in medical care. If you want to learn more about modeling surgical interventions project by open source research collaboration, then contact us. We will be happy to involve you, and we will be also happy to come to your hospital or university and talk about this project and other projects and explore how can we collaborate to breed innovators through workshops, courses, and research. So I hope that you enjoyed this presentation, and if you want to hear more about innovation in surgery, visit our website, open source research collaboration.network. See you next time with a new presentation. Bye bye.